Hi, everyone, and thank you for joining us in Master Your Breath, Transform Your Life. I have a lot of things to tell you, and first I'm going to introduce myself. I am Patty McShane. I'm also known as Miss Patty. I am the lead calibrationist at Total Relief Method, and I am proud to say that I am an honored student of Dr. Rubenstein and his method. And so today I will be giving you just a small portion of what I've learned from him over the last 4 years. I've been working with him since January of 2020 and studying under him. You know, his apprenticeship has been so comprehensive, and I've never learned so much in my entire life. And what I've experienced has been so powerful and profound. And I'm going to share some of that with you today. A lot of the information that I'm going to give you today is going to land on you as reasonable and logical, because this is all science-based, and I'll show you how that works. So who is Dr. Rubenstein? He started out as a fitness instructor. Then he got his bachelor's and his master's in kinesiology, and then went on to get his PhD in medical science. So he has been an adjunct professor, and he does direct work as a stress physiologist. He has been a senior clinic instructor at White Memorial Center and specializing in fascial pain clinic. And he's published 2 articles in the Pain Management magazine. This first one he did went #1 in the medical community. It was on the kinetic chain from the toes influence and the jaw. And he's also published 3 books, and this is one of them. You can see his young, handsome face when he did publish this book. And he's got another one coming on the way on PTSD. His special focus is functional enhancements of the brain. And he's an international speaker on stress and its impact to the brain. And of course, he's the inventor of the Total Relief Method and neuromuscular calibration technology. We work at Total Relief Method using the Rubenstein method. So what you will learn today, I'll tell you about Total Relief modality. What is the Rubenstein method? I'll also talk about the stress index, and this is the science behind the method, the proof that the breathing, which is where we start, predicts everything. The diaphragm muscle, your largest breathing muscle, and its function. The optimal gas exchange. So what's the difference between your upper lungs and your lower lungs? Well, there's a big difference, and I will go through that. Accessory breathers. You have 5 muscles that are overworked and causing pain because that diaphragm muscle is not working properly. And I will also talk about the stress cycle. So the way that, because you've had trauma, it changes the way that you're breathing, and it is now affecting your health and wellness. Stress hormones. What happens during a stress episode? Background stress, the stress that's always there, and you may not even know it. The recovery session. So how do we address this? And then the trumpet, I'm going to go through and show you this technique. And this is going to give you immediate relief to your stress that you may not even know is there. So what is the Rubenstein method, and what does it do? Well, it was developed by David Rubenstein, PhD, almost 2 decades ago. And this powerful paradigm treats depression, anxiety, PTSD, insomnia, TMD, right? So the jaw pain, chronic pain. And we do it without drugs or invasive procedures. And you're like, well, how do you do that? Well, it's a rapid recovery non-medical therapy. And it uses small and precise resistance motions called calibrations to establish new signal patterns in the brain, mind, and body. So we basically, through these slow, methodic movements, put your brain into almost like a little trance. It's very interesting, but it gets your mind to focus, hyper-focus on what's going on in your body. And it has been tested by third parties and has been found to create results that have never been witnessed or documented before. So here's the science behind it all. We can, just by watching you breathe and how often you breathe a minute, we can tell you exactly where you are. Exactly where you are. So if you're breathing 19 minutes or more in a minute, chances are you're waking up exhausted. You may have sleep apnea or snoring. You may have severe chronic pain. And your focus and concentration is in the toilet. So with our method, what we're doing is we're getting you to go to the right. We're trying to get you out of fight or flight. We're getting you to reduce your respiratory rate. That's where we start. And as we do that, wonderful things start happening. You're starting to wake up more recovered. You're not waking up as much every night. You're needing less sleep every night. Your pain is going to go down because the stress is going to go down. The stress is directly related to how much pain you're feeling. And then your focus and concentration is going to get so much better. So it all starts with the diaphragm muscle. So believe it or not, friends, this is your diaphragm muscle. Isn't that crazy? Look how big it is. It expands the entire width of the bottom part of your rib cage. This is your main breathing muscle. And as you notice, there is a piece of it, right, that goes down here that is connected to your vertebrae. So when you breathe, and this muscle, when you inhale, it contracts. And when you exhale, it relaxes. But what happens down here is it respirates your spine. So when you've had trauma and your diaphragm muscle isn't working properly, you start feeling like you have lower back pain. This is why. Believe it or not, this is why. A lot of times when we've activated the diaphragm, back pain goes away instantly. So the other thing that the diaphragm muscle does is it brings air all the way through the lungs to the bottom of the lungs. It lengthens the lungs. The reason why we want to get oxygen down to the bottom of the lungs is because that's where the optimal gas exchange is. That's where the most oxygen is getting into your system to go to your brain and your organs. There is no substitute for this. None. There's nowhere else in the body that is going to get that kind of oxygen to your body and brain. So, as I mentioned, it's moving your cervical and lumbar spine. It is the number one core muscle of your body. It is the primary pump for lymph nodes. 40% of your lymph nodes are under your diaphragm. And when your diaphragm is working, it's flushing those out. And that's what you need to do, because that's where all of the toxins build up. So let's talk about why it's important to get oxygen into the entire lung. So upper infections, you're going to experience common colds, sinusitis. If you have issues and you're not getting air into the bottom of your lungs, you're going to get bronchitis, pneumonia. You're familiar with these, right? So I ask you, which one is more deadly? Do people die of a common cold, or they die of pneumonia? So the majority of oxygen delivered to the brain and the organs are in the lower part of the lungs. You get air down there. We can help people that have asthma. We have wonderful recovery from bronchitis, pneumonia. So the lungs are giving oxygen to your system, the heart, getting it to everybody else. And that is the goal. All right, so let's talk about, well, if the diaphragm isn't working, then how am I breathing? Well, you've got 5 accessory breathers in your body. And we can tell when they're working over time because you're going to feel certain pains. You're going to be getting headaches. You're going to be getting tension and pain in your neck and your shoulders. Most headaches and tension is caused by malfunctioning or overworked muscles. So let's start with the trapezius muscle. This is right on top of your shoulder here. If you're getting pain in your temples, along the neck, maybe in the back of the head, it's caused by your trapezius muscle. Your levator scapula, which is along the back of the neck here. If you're feeling pain back there, it's your levator scapula. Your scalenes, which are on the side of your neck, next to the sternocleidomastoid. There's 3 of them. So if you're getting pain in, like right between your shoulder blades, down your arm, right? Kind of here in the chest area, even your thumb and your hand, those are your scalenes that are causing that pain. And then there's sternocleidomastoid, or we call SCM. That's the big one right here on the side of your neck. It lifts the rib cage up and down and it pulls the head forward. But if you're getting pain up over your eyebrow, behind the ear, that's the sternocleidomastoid. And then the pec minor. Now, everyone knows they have a pec muscle, but a lot of people don't know about the pec minor. It is a problem child for shoulder pain. I myself had really bad shoulder pain. We did a calibration on the pec minor, went away, never came back. So let's talk about the chronic stress cycle. This is what happens. This is how your diaphragm gets affected and how you're in fight or flight. You don't even know it. You've had a trauma. Okay, everyone's had a trauma, something that scared them. This trauma could be physical, it could be emotional, it could have happened in utero. It could have happened because your mother fell when she was pregnant with you. But whatever it is, it changed the way that you breathe now. And your brain doesn't know it. There was no switch that said, oh, I'm not breathing the way that I should be breathing. Let's just turn that muscle back on. Doesn't work that way, unfortunately. So what happens? You start breathing with your shoulders. Take a really deep breath right now and pay attention to your shoulders. Now, if they went up a lot, it means that you're engaging all of your accessory breathers at maximum. Now, obviously, they're helping you breathe. So they're not ever going to be turned off to helping you breathe. You will feel some motion in your shoulders. But if it's a lot, you'll see people, if they take a deep breath and their shoulders come up here, their diaphragm is not working. So what happens then is you clench your jaw. If you're anyone here that feeling jaw pain, this is the stress button of your body. And what does it do? It causes your muscles to tense. Your body has no other recourse than to do this when you're clenching your jaw. What happens when you have muscle tension like this? Well, it causes joint compression, which causes inflammation. And that inflammation, as you know, causes pain. And can you sleep when you're in a lot of pain? No, not really, not well. That causes higher stress because you're not recovering at night. and it all starts all over again. What happens when you have a stress episode? If you're using your diaphragm, that recovery time is shortened by hours. If your diaphragm is not breathing, it may take you 3 hours to recover from that one incident. Maybe it's a near miss, almost you collided with someone, heart's racing, like, oh, wow, that's crazy. It could take 3 hours for you to calm down from that. What's happening is you got a rush of adrenaline and norepinephrine and cortisol. And those things keep you in fight or flight. So what we do at Total Relief Method is we bring down all of those chemicals and we reintroduce all the good ones, the serotonin, which in turn, when you have more serotonin, you're happier, you're calmer. So what is background stress? So a lot of our clients come in and we ask them this question: how stressed do you feel that you are between the scale of 1 and 10? Give us a number. How stressed are you all the time? Some people, they say, 4 or 5. On average, it's about 7. People don't really realize how stressed they are. But when you build all of this up, right, irritability, a sudden or slow burn trauma, episodic spillovers, high triggerable, right, emotional suffering, and fear or a busy mind. All of these things are running in your program and they're unconscious. You don't even realize. But when something stressful happens, boom, you go off like a bomb. Now, this could be an external explosion or an internal one. Either way, it's big and you feel it. So what we do at Total Relief Method is we get your system to calm down so that suddenly those episodes are smaller and smaller and fewer. And we're talking in weeks' time to where stress, you're practically unperturbable. I love that word, unperturbable. Can you imagine that? Wow. So it all starts with our recovery session. Our recovery session is the very first session that you have with us. There's no obligation to carry on with our program, although the majority of people do because of how they feel after this very first session. And it is the thing that we do with everyone that comes through our door, and we immediately get that diaphragm working again. So during the sessions, these calibrations, we have you engage directly with us. Okay, this isn't this is what we're doing to you. It's a team effort. You are present and you are helping us make these movements because we need you to do this. That's part of this treatment. So what we do is we use specific contact points that when touched by a practitioner, it triggers specific muscle reflexes. The client pushes against the practitioner's hands while being guided verbally to move in a precise direction. We also do it in a specific speed, which is very slow, causing you to have to focus even harder. Because we don't want you to necessarily muscle your way through it. We need to use your brain power. So this proprietary motion recipe gently triggers the brain into a hyper-learning state. And during this state, the brain removes incorrect, inefficient, and extraneous signals and replaces them with highly refined patterns, not only for motion, but for thinking, emotion, and behavior. So basically, we are tapping into your core consciousness. No other therapy does this. So what happens in a recovery session? Well, our session is $300, which is $50 off 50% off of our normal session price, and is about an hour and a half to 2 hours long. How often do you go to a doctor's office and spend an hour and a half to 2 hours with a doctor? Doesn't happen, does it? Each of our sessions are at least that long. Because what we're doing, not even trying to do, what we're doing is we're going to the specific cause of your problem and fixing it permanently. We activate the diaphragm to get you breathing more optimally. That's first and foremost, right? After our consultation of getting everybody on the same page. Then what we do is we calibrate your TMJ, your jaw. And we relax the trigeminal nerve located in your jaw. And what happens when we do that is your body starts to relax too. Then we teach you a powerful breathing technique to support you moving forward. And it's designed to get everyone on the same page regarding the issues that you wish to address and provide you with education about our method. So what can you expect? You can expect a level of relaxation that you haven't felt in years, perhaps ever. Your mind will know what it feels like to be clear and quiet, and you will feel more present in time. Any physical pain that you may be experiencing will be reduced or eliminated, and you will be instructed on the trumpet breathing technique, which I'm going to go through with you today. And this will help you relax and return to center in times of stress. And afterwards, you may feel like you're ready for a nap because, we used up a lot of brain juice in this session. We have protein bars, we have water in the office for this reason. So you may want to take a nap. We encourage you to eat something following the session and get some rest. So if you have anything planned after the session, we suggest otherwise. We want you to rest because you're going to need it. Okay, so I'm going to go through the trumpet. The trumpet is something, it's a tool that you have. You don't have to remember to put it in your car or put it in your purse or stick it in your pocket. It's always with you because it's your dominant hand. So I'll want you to try this with me. I want you to go ahead and fold your fingers over the palm of your hand to the heel of your hand. It's going to be a nice soft fist. The hole is going to be the size of your ring finger of your opposite hand. When you pull it out, you're going to have a hole. You should see a hole. That is perfectly sized for you. You're going to take 3 deep breaths, and I will demonstrate what these sound like, and also the cadence of it is very important. Okay, it goes like this. And then you stop. You resume normal breathing. Go ahead, try it. Okay, now resume normal breathing. And I want you to notice your body. Really tap into your body. You may feel a little lightheaded. I call that a happy side effect. And I want you to see if your body relaxed a little, right? Just sit back and really tap in and feel your body relax. Did your body relax? Did your mind relax? And did it clear a little? So, this is the trumpet. When you're feeling stressed, do a trumpet. And then and don't do it standing up. You got to be sitting down or laying down so that your body is allowed to relax. You can do these 5 times if you want, right? 5 times in a row. However, between each one, I want you to stop, resume more normal breathing, tap into your body, and ask yourself those 3 questions. Did my body relax? Did my mind relax? And did it clear a little? And that is my gift to you for today. So, what did we learn today? We learned, hold on, let me get rid of this. What is the Rubenstein method? Well, now you know. You know that breathing predicts everything. You know that the diaphragm muscle is the largest breathing muscle, and you know what it does. You know where optimal gas exchange occurs and why it's important. You now know what the 5 accessory breathers are and why they cause you pain. And you also know that how maladaptive breathing affects your health and wellness. You also know what happens during a stress episode and what hormones are responsible. You know about background stress and how it determines stress reactivity. You understand what can be done to activate the diaphragm and begin healing. And now you know a breathing technique that will relieve stress immediately. So, what is the next step? Well, you come in for a recovery session so we can activate your diaphragm. So here is all of my information. You can reach me at patty@totalreliefmethod.com. I'm also located via text or phone at 714-392-2458. And then we have the QR code to check out more testimonial videos. It's a link tree. So it has a link to our website. It has a link to videos. It has a link to forms to fill out. So if you have any questions at all, please call, email, text. I am here for you. And thank you all for attending.